Hello, everyone. Thank you for joining our webinar today. My name is Beth Schlachter, and I'm Executive Director of FP 2020. And I'm joined by Deloitte colleagues here today to share with you the results of the global consultation that many of you have participated in since the beginning of this year to help us shape a vision for what will come next after FP 2020. So we're really excited to share the outcomes of the global consultation with you. And before we get into that, I wanted to explain a few logistics about the webinar. We have an hour together, and it will be me and Hannah Patterson from Deloitte sharing the outcome of the consultation with you, and then there will be time for Q&A. So during the course of the webinar, if you have any logistical issues that need to be addressed, please let us know through the chat pod that you'll see to the right of your screen. And if you have any questions on content, then please submit those through the Q&A pod that you'll also see available. If that gets mixed up, it's okay, but it's just easier for us to track if we have all the Q&A questions in one place. In the event that you're unable to reach us or you need to email us, you can also use our email address, info@familyplanning2020.org. And as a reminder, this webinar is being recorded, and so you'll be able to access this and share it with other colleagues as well afterwards if you'd like to. And we just want to thank you for joining. So you'll know that we have launched on our website as well the features that you're going to see during this webinar today. So you'll be able to contribute to the consultation, which is continuing to be an iterative process through the end of this year. Hannah will bring you up to date on what we've done so far, and then we'll share with you where we're going to be going through the summer and into the fall as well. So we'll provide opportunities for you to continue to let us know if we're on track, if we're missing anything, where we should put areas of emphasis, and importantly, how it is that we're going to shape the partnership so that we're going to continue this momentum and build on the success that we've had. So again, we see this as being an iterative process, and we're sharing with you today where we are at this point in the consultation process. So one of the things that's emerged through the conversation as well is really a conversation around how we're shifting from an MDG mindset, which was focused on global poverty, and to a framework that's looking at the SDGs, which, as you know, is a much more holistic approach. It asks for different partnerships, and it asks us as well to consider what the impact is of our particular area of development on other areas of development, and how we can work more effectively together for shared success. For FP 2020, we're also seeing this as a moment of putting more emphasis on individual women and girls, their needs and their objectives. And so we see this as an opportunity to really sort of shift that paradigm for ourselves as well. So we know there are still key strategic choices that have yet to be resolved, and we expect that you'll raise many of those points with us today. But again, we want to walk you through what the consultation has been, what our interpretation of that is, and a draft framework for our approach, again, to get your feedback. And once we have the vision in the place that we think it can be most effective later this year, then we'll start talking about the shape of the partnership, how it is that we work, where the secretariat is, how we continue to move forward as a global community. So with that, I'm going to hand it over to my colleague, Hannah Patterson at Deloitte, and she's going to walk you through our initial findings today. So Hannah, over to you.
Perfect. Thank you, Beth. So as Beth mentioned, the objective as we engaged in this consultation was really to make sure that we were laser focused on engaging a broader set of voices to ensure that everyone felt like they were informing the post-2020 vision, and that it could really be something that galvanizes the global family planning community. So we really kept that kind of notion at heart as we proceeded through this process, and wanted to make sure that we were using this moment to build on momentum that has been achieved since 2012, and also think about how to accelerate impact as we move forward into the next decade, and think about how we want or what we want to achieve by 2030. So in order to do this, we started back in January um, by thinking through how we were going to engage the community. And we did that in three primary ways. So we conducted in some individual interviews. We also did some focus groups, which in a minute I'll show you where those focus groups were conducted around the world, where we brought together small groups of individuals and spoke with them and got their feedback in a small group setting. We also collected feedback through a survey, and the survey was both sent out to specific individuals and also posted on the FP 2020 website, where anyone who was interested was able to access and provide their input via the survey. So once that kind of data collection period ended around the March timeframe, we really moved forward into the data analysis and synthesis of findings. And we looked at both the quantitative and qualitative data that we had received from the data gathering phase, and started to glean, where was the community at this point? What do they think has gone well? What do they think might be some potential opportunities in the next decade that they feel could be capitalized to continue to make more impact. And so we shared those initial findings with both the reference group and worked very closely with the core conveners to really pull out kind of the key pieces and findings from that and shape what Beth will share shortly as the emerging vision and potential focus areas. So in May, we really spent a lot of time thinking about what needs to be represented in the emerging vision, what does that then inform for focus areas, and how does that start to take shape. So there was a lot of time spent on the words that were used, and we'll be very interested to hear all of your input on that emerging vision that we share. Then in June, at the very beginning of this month at Women Deliver, we, for the first time, shared the emerging vision publicly. And so that was shared in a couple of different settings at Women Deliver, and also launched, as Beth mentioned, on the FP 2020 website, where you can go and see that information and also provide your feedback there. So currently we're in a period of gathering feedback from the global community, which we'll be very interested to hear the comments and questions from the group here today, and also continuing to collect that feedback through the website. So before we get into what the emerging vision is, it's good to take a step back and think about what we're trying to achieve with a post-2020 vision. So there's a few things that we pulled together to remind everyone what this should be. So number one, we think it should be activating. So this is a statement that should encompass the broader FP community and should be motivating. It should be articulate. So we want something that is not an essay. We want it to be brief and simple, but I will also say that we're not to the point, a vision statement is also not, a really, really short kind of the statement that you have right now of 120 by 20. That's more of like a tagline. So the vision statement's a little bit longer than that, but it still shouldn't be an essay. It should also be aspirational. So it's not something that we're certain we can achieve, but it's something that we're aiming to achieve. And we do think is feasible, but we should still be striving and kind of pushing ourselves to achieve something that's pretty aspirational. We also want something that's accessible, so individuals in the broad community can see where they fit within this vision. It should also be anchoring, so it's memorable and can serve as a true north for the community. So now we're going to move into what we actually heard. But before Beth shares the emerging vision, we're going to talk a little bit about who participated from the community. So the slide you see now shows that we had approximately 1,000 stakeholders from across the globe who participated in one of those three forms of input that I mentioned. So either through an interview, a focus group, or the online survey. So as you can see here, we've called out where we actually conducted the focus groups or working sessions. So we were very intentional about trying to, number one, target a variety of geographies, and also try to take advantage of different conferences or sessions that were already taking place, where we thought we would be able to engage a broad set of both members of the family planning community, and also think about getting some other voices involved in the conversation as well. So we were very intentional about where we plan to have the working sessions, but also the countries that are highlighted in the green color also show, the variety of locations where we had respondents, either through any of the forms of response. We also wanted to share just where the individuals came from, what types of organizations do they represent, and how much experience do they have within family planning. So this shows you that we did get a diverse set of experience and expertise. On the left-hand side, you can see the types of organizations that the respondents work for, and we can also see the number of years of experience they have in family planning. So the average years of experience was 11, but we also, as I mentioned, wanted to make sure that we had those voices that maybe aren't the traditional voices within family planning. So you can also see that we had about 5% of the participants who had no experience in family planning, and they were from other areas such as the environment, economic development, and we wanted to make sure that those groups that are involved in different areas of the development world also had an opportunity to weigh in on what do they think about the future of family planning and how do they see that kind of working within the next decade. We can move forward. So on this slide, you'll see, first of all, that this is just an array. So there's no kind of intentional order or structure to the types of topics we heard, but this is just to show, out of all of the information and data we collected, at a macro level, what were some of the core concepts that we heard fairly frequently from the global community. So you'll hopefully be able to see some things that are, a lot of this will probably be very familiar. There may be some things that are maybe you don't think about as much or not as top of mind, but I think overall there was a lot of alignment in terms of what are some of the concepts that should be focused on going forward. And I'll just highlight a couple of them. So the first one is really around accountability. So we heard a lot of different feedback on how the family planning community should think about accountability as you move forward into the next decade, whether that's governmental accountability and at what level does that happen, who's holding individuals and governments accountable, and how is that going to work going forward. Also, normalization was a big topic of conversation and feedback, and the overarching opinion here was that in the next decade, really in order to address the barriers to access, we really need to think about how we're going to address kind of social and cultural norms, and kind of how do we continue to work within local communities to ensure that there's less stigma associated with family planning. So with that, I'm going to turn it back over to Beth, but I will still be on the line for the Q&A part of the discussion. Thank you.
Thanks very much, Hannah. So our next slide was built as a word cloud using the words that popped up the most when we asked the global community to describe their vision for family planning. What are the key concepts and areas that you think are really important that you want to see come out of our work over the next decade and into 2030? So again, this word cloud was created using responses from the interviews, the focus groups, and the survey, so the full scope of participants. And we use this word cloud to create the next slide. That will share with you what our actual emerging vision is. And again, this is, as Hannah said, not a tagline, but really a description of what it is that we hope to achieve through partnership into 2030. And I'll read it just to make sure that it's quite clear for everyone who's on the line. Family Planning 2030, working together for a future where women and adolescent girls everywhere have the freedom to make their own informed decisions about using modern contraception and having children, lead healthy lives, and participate as equals in society and its development. So in sharing this vision with you, we want to, again, get your feedback and reflections and refine this until it becomes a final vision. Again, it was built using input from the community and the particular tag words, and with input from the reference group, the secretariat, the core conveners, and is reflective of all of the input that we've received so far. So again, as we're shifting into an SDG world, we're reframing the starting point again to focus on women and girls and their needs. So at the top of the framework, you see the emerging vision. And before we go into the 7 different areas that we've laid out for you below, we also wanted to share that we felt there were some guiding principles that we're going to apply across all of our work. So of course, a rights-based, voluntary, client-centered approach is foundational to everything that we do. We also wanted to ensure that there's a specific focus on adolescents and youth. And that's not to say that we focus on adolescents and youth to the exclusion of everybody else, but rather that all of our efforts need a specific lens that ensures that we're reaching young people and adolescent populations as well. And then another key factor of all this work is that we will remain a country-led global partnership that uses data and evidence as the foundation of our efforts and our work. Within this, of course, is a focus on services, and that's some of the feedback that we had already, is that it's not clear from this framework that we mean to focus on the outcome, on how services are delivered, and on the partnership that brings all this together to ensure that services both are improved and that they reach more populations. So that's embedded within these guiding principles as well, and we'll make that clearer as we go forward. So now I'm going to go through each of the specific pillars of this framework. So the first is that we're going to focus on the policy agenda. So again, these aren't ordered in any particular order of emphasis. Each of these we think is important in its own right. But of course, we understand that policy forms the foundation of any program and really shapes the operating environment for family planning programs. And we've learned through the FP 2020 iteration of this partnership that we have the potential as a community to significantly shape the policy agenda, both at the country level and at the local level, as well as the global level. So we're going to keep a focus on this area while we look at working with new actors and building partnerships with new sectors that we think can give us a new slant to how it is that we achieve our work. And again, this is where the SDG framework comes to mind, because it really requires of all of us that we work in new ways, and in doing so have the potential to have an impact on the policy agenda going forward. Next slide, please. So the next area is focusing, as always, on the data-informed decisions. So this is where we've made significant progress under the FP 2020 partnership, both the way that we use data, the data that we have, and the data-informed decisions, all of that have improved significantly, building on the backbone of things like the DHS, but also adding in improved NICS and LMIS surveys, in addition to the work that PMA is doing, and the training and the partnership through Track 20 with improved capacity through monitoring and evaluation officers. All of that has really sort of improved the scope of the work that we're building on over the last 50 years that have really set out the landscape for family planning. So we're going to continue to drive on this area. It remains critical, and it will be a key focus of our work going forward. So the next focus area is around placing equity at the core. And I'm going to spend a few minutes on this concept because we want to make sure that we share with you everything that we see sort of within this, because going back to those word clouds and remembering what it is that the community gave us as feedback for areas that we want to focus on, it's not just the who, but the how that people receive services. So within the concept of equity, we want to make sure that we take that concept of leaving no one behind to heart. And so we have a specific emphasis and approach to reaching adolescents and youth, that we consider the needs of LGBTQI populations, that the disabled persons are seen and understood within the context of policy, program, and service delivery, that we're seeking to reach rural populations who are harder to reach, as well as the urban poor, and that we continue to have a specific emphasis on humanitarian populations, not just reaching them with services, but also better understanding the operational context as development actors and how we can support our colleagues working in humanitarian areas, as well as thinking about resilience ahead of time. How do we plan for disruption? Just last week was World Refugee Day, where it was announced that there are more refugees now than at any time since World War II. And unfortunately, the context of our time is that many people are displaced and will continue to be displaced, and they will be displaced for longer periods of time before conditions are safe for them to return. So we must look at resilience planning ahead of time, and we also must look at how we bridge that relief to development divide, knowing that refugee contexts aren't just an initial safe haven, but often long-term sheltering, with many people even living their entire lives within a refugee context. So we have to think of that paradigm differently, and we must partner with humanitarian actors in new ways in order to ensure that we're embracing this concept of equity at our core. Next slide, please. So expanding accountability. As Hannah said, it's important that we challenge ourselves to understand what the next steps are to push into with regard to accountability. Part of the paradigm shift with FP 2020 was that we're led by country commitments, and it's a partnership to achieve those commitments that's allowed partners to continue to work together, but also framed everything within the context of what the government itself wants to deliver for their own people. And that's a really fundamental and important distinction that we think also opens up additional space for partnering with governments so that they are able to achieve what they've committed to achieve, and that we are thinking of accountability as a partnership for success. So there's more space within that, I think, to better understand what's being achieved and what the blockages are, and to be able to look at that in a clear-sighted way that doesn't name and shame, but instead understands the context of where we have challenges that are in the way of progress, and that empowers civil society to partner with government to overcome those barriers. So how we shape this agenda will remain focused on country-specific commitments that see FP, family planning, within the context of the broader scope of sexual and reproductive health and rights, services, and needs, but also puts it squarely within a primary healthcare context that then links to these concepts of universal health care and universal health coverage. And we know that that's an incredibly complex array of both frameworks and perspectives, both funding and service delivery. But that's the reality of the work of the world that we're working within right now. So this concept of accountability, I think, pushes us forward into better partnerships with more information that help really hold us all accountable as partners with governments to achieve these goals. And we intend to step into that space more explicitly and make new commitments even sharper so that all of us see ourselves within this accountability framework. Next slide, please. So increasing and diversifying financing. We know this is important. We are now serving more women and girls than ever with family planning services, but the funding for family planning hasn't necessarily increased. And so we're going to need to make some hard choices if we're going to be able to pay for not only reaching more people, but improving the service delivery along the way. So how are we going to do that? We know that we need to diversify the funding pool, and we see that more governments than ever before are stepping forward to actually fund family planning programs. And that's a game changer in itself. We know that all countries won't be able to do this at the same rate or to the same degree. But as and where they can, we see that governments are taking on that responsibility for themselves. But again, they do so in an increasingly complex environment where many countries are devolving health down to local levels. So there's complexity within that, particularly when we consider supply chains and the need to continue to have efficient services and systems. We're also looking at universal health coverage, which includes incorporating concepts of insurance schemes and how middle class and higher income people will be able to pay for services themselves. We have the Global Financing Facility, which is partnering with World Bank resources in a new way to expand the envelope of financing that's available to countries to make those urgent health investments that are going to allow them to accelerate a lot of sort of development objectives because health is improved across the board. All of that is very complex. And we also know that many countries are going over the next decade to shift into middle income status, where more people will be paying for their healthcare out of pocket themselves. So this is going to require more nuanced and sophisticated partnerships with financing mechanisms and those who are managing budgets themselves, both in countries and globally. And we intend that this partnership will have the intentionality to do this in a way that's going to continue to keep family planning on that development agenda and receiving the funding it needs to expand. So this flows into our next slide, which is on incentivizing sustainable markets. And I want to make this shift within that context of the private sector and the public sector, because we're going to need to ensure that commodities, a wide range of commodities, are available in both sectors. And that as the private sector becomes a more important space for more people to purchase their own contraceptives, that we're still providing a range of contraceptives within the public sector service outposts as well. So again, a lot of complexity within this to think about both the development of new methods that will meet the needs of women and girls. Many of you were a part of the ECHO trial and the outcomes of that trial in recent weeks, where we feel this incredible imperative, a clarion call to have better integrated services for both HIV and family planning, including methods that can provide dual and triple protection. And we know that those are on the horizon for us. So as we're expanding methods that are in the control of women themselves, and we're looking at the range of methods that need to be available in public and private settings, sustainable markets are the basis of all of this, and we need to make sure that we're talking to a wide range of partners to continue to drive on this objective. Our next and last pillar, and by no means the least important, is influencing social and gender norms. And as Hannah said, this is one that came up as incredibly important to many of those of you who participated in the consultation, because we know that as much as family planning is a health intervention, it's also a social issue. And it's often the social norms that are the barriers and also the potential openings for us to expand family planning access. So this is where we want to ensure that we're partnering with men and boys who also have contraceptive needs and reproductive health needs, but they're also importantly partners in whether or not women and girls have access to contraception. So we want to make sure that there's increased intentionality in both meeting the needs of men and boys and working with them as important partners with regard to contraception and family planning. We need to be working with departments of education and those who are providing sexuality education within schools, with faith partners, and with local and family power structures to change those norms and dynamics so that women and girls can have access to the contraceptives and the healthcare systems and services that they need and deserve. So that's an incredibly complex area. And we know that whether or not women have access to contraception is only one piece of the puzzle. The other piece is whether they feel they're getting the services they need, that they get the counseling they need, and they feel that they can make contraceptive choices in partnership and importantly for themselves. So those are the pillars that we have, and this is what we'd like to get your feedback on. So what happens next is that we're going to invite all of you to go to our website and give us your feedback on this framework and on our emerging vision. And then FP 2020, the Secretariat and our core convening partners, USAID, UNFPA, the Bill and Melinda Gates Foundation, and the UK Department for International Development will continue to work with your feedback over the course of this summer to refine this emerging vision and these pillars. We'll share that with FP 2020's reference group, and we'll continue to get their feedback as well. And then this fall, around the Nairobi ICPD at 25 Summit, we will share this sort of emerged vision with all of you. And then from there, we'll begin the conversations around the structure of FP 2020, so that we look at the year of 2020 and 2021 as a period of transition, as we look at, again, what the scope of the partnership is, where it will live. Will there be a secretariat? Should it continue to be here in DC? Should we have this structure be maintained? Will other donors join the sort of core convener part of this process? Will we be located in regional areas? So perhaps we have different approaches for different regions, maybe focusing more explicitly on advocacy in Latin America, a continued sharp focus on programs, policies in West Africa, Central and Southern and Eastern Africa as well. How do we work with countries that are a little farther ahead in Asia and the Pacific? What's needed from all of this? And so we'll continue that consultation process with all of you about what that structure is, and that'll be the 2020 and 2021 conversations. So for now, what we're hoping to land through the next month in consultation and consensus with all of you is the vision that will drive those decisions. So this invitation to hear from all of you today and to get your feedback online are really important. We're also working with our Deloitte colleagues to add more content to the website, because right now it's just the framework, and we haven't yet shared more broadly the details that I've just outlined under each of these different pillars. But we will be doing that in the next week, so that those who are only encountering this online will have the information that you've had today through this webinar to get that information. And importantly, we will also continue to work with our existing performance monitoring and evidence working group to shape the measurement agenda from all of this. And they'll be a part of shaping the vision as well, because we intend to have an agenda that continues to have core indicators that are measured globally that broadly reflect what's happening in the countries as well. So that PME working group will be core partners in this process going forward as well. So with that, I'd like to open it up now to your questions. And I see we already have a few. If you want to hand me those, we can get started, and I'll just start reading them off. And Hannah, these will be for either you or for me. And the first question asks, is the 2030 vision, is it inclusive, including women and girls with disabilities are at high risk and lack family planning information, for example, the deaf and the blind? So yes to that. As an FP community, I believe we have work to do to better understand what it means to be inclusive of those with disabilities, and to work with country partners to be able to both share where there have been successes, what the success factors have been, and then to build that in more intentionally going forward. I know that in Zambia, for example, we have a number of partners who've been working on reaching the deaf and blind populations, and they've had incredible success. So that's one example of a way that we can bring those learnings into like FP 2020 focal point workshops, for example, so that those who are shaping and crafting country programs can also be learning from where there has been success. So yes, we'll continue to work on that. This one says, impressive platform for continued work. Could you specify what you see as new within the framework? So, you know, a lot of what we saw in the feedback was a reflection back of what's currently known as being key drivers of family planning programs and success. So I agree that there's not a lot that's new within that, but for us, what's going to be new is the approach. How it is that we shape the partnership to focus on key areas, how all of this sort of continues to drive forward, where we're located, and it's really in the how of this implementation. Another key area is the real, very clear ask that we form new partnerships, and that FP, while we keep a real focus, doesn't stay outside of partnering with those who are working on the environment and climate change and mitigation. that we really actually make progress on HIV integration. We're working now with midwives to expand access to postpartum family planning and to empower midwives to do family planning counseling as a part of prenatal care. So it's really in that how we do our work that we see the newness while we keep this focus on urgency and acceleration, because it's in these new partnerships that I think that we're going to see that. And I would also point you to this expanded area of working with humanitarian partners and on resilience planning and on overall resiliency as well. And that there remains a lot of new work that needs to happen within that sector too. But again, please please share with us your thoughts and feedback on where you see new areas for work as we continue to work on family planning going forward. Because while, again, I think that point of newness is an important one to take on board and to address directly, because again, we've learned a lot through partnership together and intend to expand, but it's not that there's some new thing that needs to happen in addition to that that's going to be like some magic ticket to acceleration. It's rather focus and intentionality and expanding areas that we see as having high impact that we think are going to continue to be important, because we're going to need to continue to work on family planning and push this agenda forward. We're not going to buy our way out of it. It's rather smarter partnership and greater efficiency where we see that newness. Okay, so the next one is, there was feedback shared on the emerging vision during Women Deliver, but it has not been modified as yet from what I can recall. Will it be an iterative process, or will you wait until the consultation period has finished before revising? So we did discuss whether we wanted to take in the feedback yet and adjust this, but we felt that there were very few people at Women Deliver who were able to participate in just one session. There were about 100 people who heard that. So we wanted to share the same vision with the global community and get everybody's feedback, and then we will share this iterative process going forward. But we felt it was a little too exclusive to just act on the feedback from the people who were in that room without being able to have this be a global part of or open up the consultation globally, take in everybody's feedback, and then push that forward. So we did hear you at Women Deliver. We've taken note of that, and I think that you heard that in some of the comments that Hannah and I made as well, with a different kind of an emphasis this time. But we didn't want to completely adjust the framework yet until we'd had an opportunity to hear from more stakeholders going forward. Okay, so the next one. How can we become a partner in this effort? Well, great question. At this point, going on the website and providing us your feedback on this framework as well, so that we can pull in your feedback, and then we will continue to create opportunities like this to hear from you and build this going forward. We won't just make this an online process between now and through 2020. We'll be devising opportunities to, again, continue to hear feedback. We did so during focal point workshops, for example. We continue to ask these questions everywhere we go, but we would appreciate your thoughts on how you would like to partner as well, so that we can open up the process to be more inclusive and to more effectively hear from all of you too. Okay, will the FB 2020 HQ headquarters be moved to another region, perhaps one with a high rate of teen pregnancy? So right now, I don't have an answer for that question, because it's one of the things that's out here for consideration, is what the partnership needs to be effective at both local levels and at a global level as well. As you all know, we've been headquartered here in Washington, D.C. and hosted by the UN Foundation. It may be that that continues to be the shape of the partnership. Or it could be that it's more effective to move it to a different region. Your thoughts on that would be much appreciated. So please do give us your input on how and where you think it could be most effective and why, and we would love to hear from you on that. Okay, in a time of scarce resources, how do you envision an increase and diversification of funding? What do we do with government's unwillingness to fund family planning? Great question. I think that we haven't yet effectively worked with ministers of finance in a lot of places. I also think that we're likely to have success in domestic funding for family planning at different scale in different places. We need to better partner with advocacy communities and parliamentarians so that we're building the case for investment in family planning. We know that there's a high return on investment in family planning against all development objectives, and yet there continues to be this resistance in some places to actually funding for it. So we're going to have to get really local and specific about this, because those that lack of response, I think, is it often has the same sort of base reason, but to solve that issue country by country, we're going to have to partner in very specific ways to overcome that. We also know that there are these opportunities for investment in family planning through things like the Global Financing Facility and by shaping insurance markets as they're being built through this UHC drive. So there are different opportunities in different ways, in addition to partnering again with the private sector to ensure that there's access and that people who can pay for family planning reasonably are doing so as well. So there's a lot of shift within that that's going to require us to be really intentional about who we partner with to maximize family planning funding in each of those channels. So we will continue to work with all of you to push that forward and to see what success we can have. Okay, next question is, how will post-abortion family planning be included in the vision, a big area often neglected? So we're currently working on post-abortion family planning, and there's a partnership that was started out of the Chiang Mai meeting in 2015 on postpartum family planning that ultimately came to include post-abortion care. So obviously you find women who've had an abortion often in different places than women who have just given birth. Sometimes that's in a health facility, often it's not. So you need a very specific approach to both find women who are in need of contraception in a post-abortion setting. And there's work that's undergoing, including in partnership with JPIGO, who's been the key driver through FP 2020 on this. And this will continue to be a focus of work. And all of our partners through the core convener process are working in this area. It will continue to be an area of emphasis. Okay. Can you share more details about how the focus on youth and adolescents will develop? Will this include a youth-led process? Great question. So we continue to partner with young people in every country now who has made an FP 2020 commitment. There's now a young person who's a focal point on the FP 2020 sort of team that includes both the government, donors, and civil society. And this was to ensure that young people are a key part of the process at the country level, and they're at the table during decision-making conversations, and then bring that into focal point workshops, and are also part of the FP 2020 reference group. So we haven't created an FP 2020 youth network because we didn't want to create parallel structures, understanding there are already youth networks that are there through the ICFP and through IYAFP. Through all of these other things that are out there. So we just want to continue to partner with them to ensure that we're getting their feedback. And we've had a separate process of consultation on all of this with those youth networks to get their feedback on the FP 2020 process, what they want, what it means to be meaningfully engaged both in the consultation as FP 2020 focal points in countries and then on the reference group as well. So we'll continue to work with them to ensure that their feedback is building this from the top up. I also asked the youth group to give us their specific feedback on this framework. And if they were to, and ask them to take this framework and rewrite it for themselves and give that back as a part of the consultation as well. Does this meet your objectives? Are we using the right language? Are we targeting the right areas for focus? And how can we be more explicit in meeting the needs of young people? And so I look forward to getting that feedback from the youth consultation as well, in order to ensure that that's a key factor and a driver. And then how it is that we meet the needs of young people continues to be an area of growth that we work on in consultation with many of you. implementing partners with WHO, with UNFPA, and others who are driving that mandate to ensure that we are providing services for adolescents and youth. So that will continue to move forward. Okay, there's a related question that just came in. One thing I hear from young people is that the very term family planning doesn't speak to many young people and may even alienate them. Have you considered reframing the initiative to address this? We hear this a lot as well. And I think that's an important point for consideration in terms of how we move this forward. And when you look at the emerging vision, we talked specifically about modern contraception, to be clear about that. But we also know that family planning includes methods that are not based on contraception that are important in some areas, particularly for some areas where religion might be a barrier to access for modern contraception. And while it may not be as effective, there are methods of family planning that are not hormonally based or contraceptives themselves, including things like cycle beads that many women use. And we count those within family planning and within contraception. So contraception can be a limiting term as well in some areas. So we want to be as inclusive as possible, but also really explicit where we're talking about contraceptive access, particularly for adolescents and young people, because we know that they often are not looking to have families at all and are not looking to get pregnant. So contraception is the key word that relates to them. So while we want to be inclusive of young people, we also want to make sure that we're looking at a diverse array of contexts and needs and that we're providing for all. So feedback on this emerging vision from the youth group will be really interesting to see how that lands with them as well. Okay. Next, what is the strategic approach to women and girls in refugee camps and displaced camps where there's a high rate of childbearing and sexual violence? Do we have a sustainable partnerships with governments across camps with high childbearing rate? So right now, the way that humanitarian contexts are funded, many of the partners who work with FP 2020 have separate initiatives with regard to humanitarian settings. That's not an integrated funding approach in most contexts, as people well understand. So the work that we want to do has been really driven through the Interagency Working Group for Reproductive Health in Humanitarian Settings as a key partner, who have included access to contraception and services that help women avoid unintended pregnancy as a key pillar of the minimum initial service package, the MISP, in humanitarian contexts. And we've begun to partner with them and the key partners who are providing healthcare in humanitarian situations, including UNFPA and WHO, who provides that strategic framework, the normative standards as well, for the provision of healthcare. So we're working with all of those partners, but we understand and continue to appreciate that the funding streams for humanitarian remain separate and differentiated. In many cases, we see that because a setting might be out of an acute phase and into one that's more long-term, that maybe they need to transition off of reproductive health kits from UNFPA, where it's very expensive to provide a particular range of things within those kits, and many things go to waste. And maybe they need to go to a more sustainable supply chain that might be linked with a country provision, for example. So there are a lot of complex issues within that service provision that need to be better understood by both humanitarian and development actors so that we can prioritize how in partnership we can provide better services both in acute phases and in the long-term settings. So we'll continue to look at those issues so that we can build this area out, not looking to take over that area of humanitarian response, but again, through partnership, making better bridges and resolving problems with regard to resiliency over the long term. Okay, next question. Service, oh, this is parentheses, service, meaning quality, delivery mechanisms, linkages to communities are not explicit in this framework. This is clearly a critical focus area. Can you please comment? Yes, we agree. And we've heard this a lot, including at Women Deliver, that we weren't explicit enough, that we saw services as a key area. So we'll be adding this under the guiding principles that services are related to all of the foundation areas going forward. So that's clearly an area where we need to be more explicit, and we will be so. Okay. What plans do you have in counseling and enlightening men and husbands to have their consent in regards to their spouse's use of family planning? So this goes back to behavior change and setting norms and standards and all the work that is taking place by many of you all in terms of partnership with men and boys. So last year, we were very happy that Promundo made an FP 2020 commitment and joined the partnership. We know this is a key area of work for USAID and for UNFPA. So we'll be continuing to work with partners to ensure that we see men and boys as both recipients of reproductive health care, contraceptive users, and as partners in this process. So the specificity of that, I think, will come through this consultation process of where we see these opportunities and where we need to lean in more in those areas. So if you have specific feedback on that, please do provide that through the web link. We'd love to hear your ideas. How would the partnership be both country-led and deal with the fact that many stigmatized minorities are left out more or less on purpose? Example, pastorists or Ebola survivors. So again, a complex question. So one where partnering with civil society, I think, is foundational and really important. A lot of work has been done on advocacy, but we also see in a lot of areas that there's a shrinking space for civil society partners to operate, and that funding for advocacy is often deprioritized, where we know that services themselves need to be expanding. So in a very tight fiscal space, it remains a very difficult operating environment. And part of what we try to do is to shine a light on that need so that as and where we can prioritize advocacy and reaching these populations and talking more about that we do that. From a global partnership, we can certainly add these issues in as areas of priority so that they're not forgotten from the global conversation and then pushed into what's happening at the country level. But I agree that these are areas that remain difficult areas to work, and that we'll have to continue to be more explicit as we prioritize these efforts going forward. And learning from where we have failed, I think, is also an important part of this. Where did we not reach people? What didn't we do right? And how can we learn from that and do better the next time? I think is a key principle of the FP 2020 partnership, and one where these areas in particular provide us, I think, a spotlight of where we need to do more. And you have our commitment that we'll be looking at that. And again, where you have lessons learned and you see areas where you want us to do more, please share that feedback with us as well. So next question, last question, or these two, the last two?
I encourage people after this question.
Okay. All right, so there's two last questions. How can you clarify how you'll be intentional in addressing social norms? So I feel like I've answered that in the course of other questions. The next one is, how are we getting input from ultimate stakeholders, vulnerable women, girls, men, and boys in this vision? And that's a great question, because that's really difficult to do, isn't it? So this is, again, a global conversation. We're making a specific effort to reach civil society partners in countries, and we hope that through your knowledge and information that you'll help us with that as well. So that through advocacy partners, through grassroots organizations, that we're reaching partners who are in the countries themselves, who can share from their experience what works and what doesn't. And we know that that's happening in some places, probably not all. But I'm going to think a lot more about that question as well, and challenge our core partners here to ensure that we're doing this. But where you all are in countries, it's really going to take your partnership to help us with that. I sit in an office in Washington, D.C. Many of you are in the country and in the field. So your ideas about how we can more effectively reach people would be really appreciated. So our last question to you is just that you visit our website, that you continue to provide additional feedback. We will work with our Deloitte colleagues, and again, many thanks to Hannah for being on the webinar today, to build out the website so those who aren't able to participate in a webinar like this or wouldn't have time to listen to it will better understand what's underneath this framework. That'll be coming in the coming weeks, which is why we've done sort of a soft launch of the website itself. We wanted to have this webinar in place to reach all of you who weren't able to be in Women Deliver and to build out that content so that we can get better informed feedback, and we will continue to create opportunities so that people can give us sort of one-to-one and direct feedback as well. So many thanks to all of you for taking the time to be online with us today. As always, we appreciate your partnership. That's the core of FP 2020, and we look forward to building the next iteration of this partnership to 2030 with all of you. Thank you for your time, your friendship, and your partnership, and goodbye.